Cervical cancer. Cancer of the cervix, usually caused by persistent infection with high-risk HPV types. Risk factors include early sexual activity, multiple partners, HPV infection, especially types 16 and 18, smoking, immunosuppression, low socioeconomic status, and lack of pap smear screening. Assessment involves abnormal vaginal bleeding, for example, after intercourse, pelvic pain, or discharge. In advanced cases, symptoms may include leg pain, backache, hematuria, and weight loss. Interventions focus on prevention, such as the HPV vaccine for ages 9 to 26 and regular pap smears. Treatments can include cryotherapy or laser ablation for early stages, and hysterectomy, chemotherapy, and radiation for advanced stages. Emotional support and sexual health education are also essential. Ovarian cancer. Often called the silent killer because it's typically diagnosed late. It originates in the ovaries and spreads to the pelvis and abdomen. Risk factors include family history, BRCA1 and BRCA2 genes, never being pregnant, nulliparity, early menarche, late menopause, and hormone replacement therapy. Assessment involves symptoms like abdominal bloating or swelling, pelvic or abdominal pain, urinary urgency or frequency, and feeling full quickly while eating. Interventions include surgical removal of the ovaries and uterus, chemotherapy such as paclitaxel and carboplatin, monitoring for ascites and bowel obstruction, and providing psychosocial support and genetic counseling. Endometrial or uterine cancer. This is cancer of the lining of the uterus and is the most common gynecologic cancer in the United States. Risk factors include unopposed estrogen exposure, for example, no progesterone, obesity, diabetes, hypertension, late menopause, early menarche, and tamoxifen use. Assessment involves postmenopausal bleeding, pelvic pain or pressure, and abnormal vaginal discharge. Interventions include a total hysterectomy with bilateral salpingo-oophorectomy, also known as TAH-BSO, radiation and/or chemotherapy, and monitoring for complications such as DVT and bladder or bowel dysfunction. Support with hormonal changes and emotional adjustment is also crucial. Breast cancer. A malignant tumor in breast tissue, commonly arising in ducts or lobules. Risk factors include female gender, age greater than 50, family history, BRCA1-2 gene mutations, early menarche, less than 12, late menopause greater than 55, nulliparity or first pregnancy after age 30, hormone replacement therapy, alcohol consumption, obesity, and a sedentary lifestyle. Assessment involves a painless lump, usually in the upper outer quadrant, nipple discharge or inversion, skin dimpling, known as peau d'orange, and axillary lymph node enlargement. Screening includes a clinical breast exam every 3 years for ages 20 to 39, annually after 40, a yearly mammogram after 40, or earlier with risk factors, and a monthly breast self-exam. Interventions include surgical options like lumpectomy, mastectomy, and breast reconstruction, as well as radiation, chemotherapy, and hormonal therapy, such as tamoxifen. If lymph nodes are removed, lymphedema precautions are necessary. No blood pressure measurements, venipuncture, or injections on the affected arm. Elevate the arm and use a compression sleeve. NCLEX tip. Teach patients to report arm swelling and practice gentle range of motion exercises post-mastectomy. Coming up in Part 5, esophageal, gastric, pancreatic, intestinal, lung, laryngeal, prostate, and bladder cancers, each with clinical presentation, risk factors, and interventions.